I'm going to let Jesse kick us off because this is actually Jesse's baby. Norwalk ACTS was the lead on this partnership. So Jesse, would you like to get us started?
Sure. Can we go to the next slide, please? So thank you, Wendy, and thank you, Bernie, and the rest of the Social Impact Partners team. My name is Jesse Buccolo. I'm currently the interim CEO for Norwalk ACTS, and I've been with the organization for the past 5 years. Norwalk ACTS is a nonprofit cross-sector cradle-to-career partnership, and we bring people together. We bring people and organizations together in a structured way to transform systems and improve outcomes for children and youth. We can go to the next slide.
Oopsies.
So we're a member of the Strive Together network, and we're one of the 5 Connecticut-based Cradle to Career partnerships here in Connecticut. Together, we make up the Connecticut Cradle to Career Coalition, and our sister organizations are in Danbury, Bridgeport, Waterbury, and Stamford. And our work is really grounded in equity. We work to ensure that every child and young person is thriving from cradle to career. We can go to the next slide. So in 2023, we received ARPA funding to partner with the city of Norwalk and coordinate workforce development. So this document on the left, or sorry, this graph on the left, you're not really supposed to see everything, but just know that this is kind of the workforce development ecosystem that exists in Norwalk, and the different blue boxes that go around are the aspects of workforce development and the partners in Norwalk that are tied to it. In the middle, you'll see Norwalk ACTS and I Love Norwalk, which is actually the city of Norwalk's new logo. So not just saying that we love Norwalk, but also trying to share that this has been a partnership with the city of Norwalk, working really to develop an integrated workforce development strategy and infrastructure for Norwalk to meet employer-driven demand and connect job seekers to educational and employment opportunities that lead to livable wage employment. So we created committees and working groups, convened cross-sector partners, launched a citywide newsletter, developed resource dashboards. And throughout this work, we recognized that there was a gap in service opportunity that was physically in Norwalk that particularly focused on the age of 18 to 26-year-olds. We know that 29% of Norwalk Public School students graduate, but they don't enroll in college. And so that's 220 students each year that graduate from high school, and then we lose them in the data of, are they on a pathway to livable wage employment and success? And do they have the skills, credentials, and certifications and training that can lead to that livable wage employment? We also want to note that 80% of that 220 students are students of color, and this is very much an equity issue and challenge that we're experiencing in Norwalk. So we can go to the next slide. So we wanted to, through all the research and work that we were doing with the city of Norwalk, we wanted to build an opportunity for students who are not planning on going to college. On the left, you'll see kind of a picture of a large group. These are Norwalk stakeholders and Baltimore stakeholders. We were really inspired by one of our Strive Together partners, Baltimore's Promise, and their collaborative partnership with Baltimore Public Schools and the city of Baltimore to provide workforce development opportunities for this particular age group. And so we invited several partners from Baltimore to Norwalk in June 2023 to share their model with the city of Norwalk, the Norwalk Public Schools, and a variety of Norwalk-based organizations and leaders that are focused on this space. Additionally, we partnered last year with Fairfield County's community foundations and their business collaborative for education equity to create a white paper that outlines the top jobs that don't require a 2 or 4-year degree in Fairfield County. Many of these jobs are in the healthcare field, and the paper also includes a series of recommendations about how to create effective programming for opportunity youth, which is what we use to help design our healthcare training pilot. And just giving Mark a shout out, Mark, myself, Lamont Daniels from the city of Norwalk, and Carol Wilshire Toth from Norwalk Public Schools spoke on a panel about this white paper and what it could mean for Norwalk. So we can go to the next slide. So this whole healthcare training pilot that you're about to hear about is really mostly funded by M&T Bank and their Amplify Fund. They've been an incredible partner, and we're really grateful for their support to get this program off the ground. And we can go to the next one. And then you'll hear that this pilot project It was really a collaborative partnership between all the partners that you see here. I explained a little bit about Fairfield County Community Foundation, their white paper, and the city of Norwalk. But as you're here, this project was really connecting career resources, Norwalk Housing, Norwalk Hospital, the Youth Business Initiative, and Open Doors. And there were several planning meetings, and you'll hear about how the different partners connect to different pieces of this pilot project. But this couldn't have been done with just Norwalk ACTS. It really takes all the partners here working collaboratively to improve the outcomes. And Social Impact Partners has been an incredible partner for the last few years. Prior to this project, Bernie and I have been working together around workforce development and how to improve it here in Norwalk, and really appreciate them as a trusted partner and really building the capacity of Norwalk ACTS and our community to strengthen our systems here. So really appreciate the work of Social Impact Partners, and particularly Bernie. And I'll turn it over to you now, Bernie.
Thanks, Jesse. So I'm going to share a little bit about the actual pilot that we did. It's kind of going to be very basic, high level initially, and then we're going to go in a little bit to what we were successful at, some challenges that we encountered during the pilot, and actually the key learnings, which I think are really going to be kind of the highlights, I think, actually of doing pilots, right, is that you learn a lot from actually implementing and what can you do better to make things effective and more streamlined going forward. So I think there was a lot of key learnings that anybody who wants to do this work could actually replicate it. And it's not just in healthcare. It can also be done in other sectors. So I think this is really it's really great work that I've been really fortunate to work with Jesse on. Norwalk ACTS has been one of our nonprofit partners that we've been working with for several years. And to get to this point was actually really exciting to actually be able to do this work, because it's something that Jesse's been very passionate about, I would say, since we started our engagement with them. I'm going to say 3 years ago, right, Jesse? I mean, we did a lot of work with infrastructure building. So this pilot was actually incredibly rewarding for me to actually be involved in. And to give opportunity use. So how we're defining that population is anybody between the ages of 18 to 26 who did not have college or career plans, were our target audience. And we were using the Norwalk Housing Authority catchment area. So that was all of their sites that they had. And we specifically targeted healthcare. Obviously, Norwalk Hospital is the major employer in Norwalk. And they agreed to provide on-the-job training opportunities for 15 individuals. We identified patient care technicians, which was a clinical role, and they developed a new on-the-job training opportunity for patient access liaisons, which was an administrative role. Jesse told you about the work that kind of went on behind the scenes, but we actually kicked off the pilot in July of 24 and completed it in December. And that essentially included everything from recruitment to the employment of the individuals who participated in the pilot. And again, could not have done this without the Amplify fund, which actually paid for the on-the-job training for candidates, but also we were able to provide achievement coaching and supportive services for the candidates during their training. And Norwalk Hospital actually Foundation had some funding available too for the patient care technicians. So it was kind of blended funding that enabled us to do this work. Next slide, please. Jesse just highlighted this was really a collective impact. It brought together many stakeholders, and every partner played a really distinct role. Our very important partner is obviously our employer partner, who agreed to take on this project with us and to offer these opportunities and to employ these individuals. So Norwalk Hospital. We worked very closely with the city of Norwalk, obviously, and the Norwalk Housing Authority, who was really instrumental in giving us access to the candidates and using their Envision Center to do our on-the-job training piece, and not on our job readiness training. And a very important partner was CRI, which is Career Resources. They provided us with the recruitment, the screening, the Strive job readiness training, and our achievement coach, which was critical to the pilot. We had additional community partners. Open Doors Economic Opportunity Hub was critical. They provided case management support for all of the individuals in the pilot and connected folks to supportive services that they needed. We also worked with the Youth Business Initiative, which was really critical for outreach. This organization was really critical with the, I would say, grassroots, doing the door knocking and really building the trust with the community we were trying to target. Again, the funding couldn't have done it without our M&T Bank and Norwalk Hospital Foundation, and obviously the strategic planning piece from the Fairfield County Community Foundation. Next slide, please. The structure, we used a comprehensive supportive model here, not only doing professional skill development, but making sure that we provided the personal support that folks needed to be successful. This was all paid, so people who participated in the program were able to leave employment that they had to seek out this opportunity. Which included 2 weeks of Strive job readiness. CRI specifically tailored their national model. They have a Strive job readiness model, but they adopted this specifically for the opportunity youth and specifically for the healthcare roles that we were trying to recruit for, to reinforce professional communication, behavior, and conflict resolution were among the skills that the folks were kind of being coached on. Again, there was about 6 to 8 weeks of paid on-the-job training at Norwalk Hospital. This provided hands-on experience in each of the healthcare roles. And we had some amazing on-the-job training providers who were really working very hard. The staff at Norwalk Hospital was exceptional. The supportive services, again, was provided by the Open Doors team, and they helped really connect people to childcare was a big one, providing financial guidance. We provided stipends for transportation, and that did become an issue, and we'll go over some. It was very nuanced what that issue was with transportation. And then achievement coaching, obviously the one-on-one support throughout the entire program, from recruitment to employment, was one-to-one support by our achievement coach. Next slide, please. The outcomes, again, this was highly targeted outreach. So 79 individuals expressed interest. The 43 were actually selected for interviews, and of that, 20 individuals were selected to undergo the Strive job readiness training. 15, actually, everybody had mock interviews with staff at Norwalk Hospital, and 15 individuals were actually selected. We selected 10 for the patient care technician role and 5 for the patient access liaison. One individual was not able to proceed, and this is also another example of how flexible Nuvance is, people with prior history, criminal records. They were very willing to work with anybody, and we're going to consider this candidate, but unfortunately his misdemeanor was under investigation. So we really could not move forward with that. And that was unfortunate. But again, this was just showing willingness to work with people with records, which I think is a big move in healthcare. Of that group, of the 14 that did go on for training, 11 completed the program. 8 of those folks were deemed work ready. And we're actually able to progress to, apply for positions and now have full-time positions at Norwalk Hospital. Next slide. Obviously that's the metrics we are accountable for all workforce development efforts that we do, how many people train, how many people are employed. But I think what we really learned is that this collective impact kind of model is really what is critically important, and the partnerships that it takes, and really having those grassroots kind of involvement at the local community level really is the critical to any efforts that we do, whether we're trying to tie things in regionally or statewide or even nationally. That grassroots is really critical. And I would say Norwalk ACTS has been an incredible partner in that sense, in that they've done an amazing job coordinating and kind of collaborating and working to develop that partnership in Norwalk. So it was kind of walking in and all the work that Jesse's been doing for the past 3 years and being able to leverage that platform to do this work. So I would say that was incredibly valuable to get us launched pretty quickly. They had also, which was very enabled, really targeted outreach, was this data agreement with Norwalk Housing and the Norwalk Public Schools. So we knew going into this that we probably had at least 50 students that met this criteria, and that Norwalk Housing was able to access those households and kind of do targeted outreach. But then we were able to use YBI and CRI to do kind of like the one-to-one engagement to make sure that folks were encouraged to take advantage of the opportunity, and they were trusted by the community because they were relatable. They were people who had shared life experiences, and that really was very valuable to getting this population involved and to take advantage of this opportunity. Again, Nuance was incredible here. Marcus, I'm going to give him an opportunity at some point to talk, but he really was superhuman, and like the obstacles he had to overcome to do this work, he had to do a lot of work internally with the team to make things work. And he was very flexible, and he kind of was tackling things like real time, which was really, I would say it was good for us. We were learning as we were going, but it also did put some pressure points on the timeline. And again, just seeing everybody working together, it was really, I would say the people that worked on this project were really the stars. We had some really great folks who were really committed to supporting these candidates and giving the kids the best chance that they had at being successful. Next slide, please. We did exit interviews. We actually interviewed everyone. We interviewed the employer, we interviewed the students, we interviewed Norwalk ACTS just to kind of get their reflection. And the biggest thing for the kids was actually the Strive job readiness training. They felt that that was the most rewarding part for them, was this Strive job readiness. I think a lot of that had to do with our facilitators. We had two amazing people. Shout out to Alicia and Sandra. But honestly, that cohort approach, I think, was really important to the candidates. They felt a sense of community. They had support from each other. They had support from their instructors, and they felt that they really learned essential life skills that were going to be helpful to them. And they felt so confident and ready to go on for the on-the-job training. So that was like an overwhelming positive from the cohort. Our achievement coach, shout out to my achievement coach. So essentially, we had, that was really a critical role. That was really needed to reinforce, one-to-one instruction over the course. Even though the Strive job readiness training was very effective, we found that we needed our achievement coach to really reinforce and keep folks engaged and retain, and to be successful in the program. Obviously, being paid was probably the most important part of this experience because it removed the financial barriers for for folks to actually be able to engage in this training opportunity. And then the on-the-job training piece really was the real world experience, kind of validated that people, in fact, were the right fit for the job that they were trying to achieve. Next slide, please. Again, 8 folks have now been employed by Norwalk Hospital. These were folks that did not have a college or career plan a year ago, so this is very hopeful. And Nuance is now actually developing a new career readiness academy and is taking the learnings that they've learned from this pilot to really incorporate it into that model. And they will be scaling this. So as you know, Norwalk Hospital is part of Nuance Health, a much larger health system, and they will be scaling this across their network, which is also really promising. They've also been working very closely with the National Fund for Workforce Solutions, doing really human-centered design to really promote the retention and career development of their employees as well. So that's also very nice outcome. And this was really one of the largest things they've done at Norwalk Hospital. Taking on these 15 students at one time was definitely something that they were very eager to do for us, which I was very excited. So we were very grateful for that. Next. Some of the challenges were really in the implementation. And I think you learn this from any pilot that you engage in. We did have an accelerated timeline. Norwalk was trying to make sure that we had folks in and hired probably in for a fall start, which made that we had to start in, kind of 6 weeks before that. To recruit, screen, employ an achievement coach, and get the process up and running. We ran into some HR processes and union negotiations, which kind of caused some delays between the on-the-job training and then the start of the after the completion of the job readiness, which actually put a little burden on the project and caused about 2 to 3 weeks where there was a training gap that required additional stipends that we had to pay the candidates to keep them engaged. We gave them some retention bonuses to keep them engaged. That was all because this was the PAL role was a new role that Nuvance had developed, and it needed a lot of approval negotiations with the union and such. And that was really kind of the reason for that delay. We also saw a very unique kind of transportation barrier, and it was really for a candidate who was off site. Anybody who was at the hospital was pretty okay, right? Because we were Norwalk Housing Association catchment area. But one student developed a problem and needed to move to Stamford and was dependent on Metro North. And even though Metro North has a connection to the Wilton site, the time the train got in did not align with the start time of the shift that she was being assigned to. So we had issues with her getting to her clinical site, and many things were tried, stipends and all kinds of things. But unfortunately, and the team loved this candidate. They actually went, I think, above and beyond to keep her. But unfortunately, that barrier was just one she couldn't overcome, and we couldn't afford to keep paying for Ubers and such to get her to work. So that was like something that I think employer partners is one of the learnings, is how do we make sure that our transit is actually working the times we need it to get people to and from work, the beginning and start of shifts. And then obviously we lost one of our achievement coaches. The initial achievement coach that we had unfortunately had to leave. And we had about 2 to 3 weeks of no service at one point where we were trying to find our new achievement coach. And that was a critical time in the project. This was in the first 2 weeks of the on-the-job training, and there was a gap where we did not have somebody who was available for the on-the-job trainers to reinforce the job readiness skills. So some of the candidates were displaying non-professional behavior that it would have been very good for us to be able to intervene earlier than we were able to. And we kind of had to catch up. Like I said, 11 finished, but only 8 actually were deemed work ready. So I think that was a missed opportunity on our behalf. Next slide, please. And then unfortunately, Norwalk could not guarantee employment for all of these folks. So it wasn't, if we could do the on-the-job training, but that didn't necessarily mean that they were all going to be employed. What they were able to say was, if you are successful at completing the program and deemed work ready, you could then apply for the position. And that was a process. That process actually took like 4 to 6 weeks for some of our candidates to actually get the guaranteed employment. So that gap between finishing the on-the-job training and achieving full-time employment, there was quite a long period of time. And that put financial strain, obviously, on the cohort, because they were waiting, waiting for the positions and waiting for their start time. So that was something we would like to hopefully alleviate in the future. We also did not have a standardized process for our achievement coach. So there was we were using Excel sheets. These are things that we would need to develop to continue this work. It needs to be a little bit more streamlined and crisp, so everybody knows their roles. What's the communication protocol? How do we make sure that everyone is on board? So if the on-the-job training folks are seeing stuff, that the achievement coach would actually be able to intervene real time. And then Norwalk actually was really stretched. Norwalk ACTS was really stretched on this because, at one point, because the patient access, we had the funding available for the patient care technicians through the Norwalk Hospital Fund, we did not have it for the patient access liaisons. And Norwalk actually had to take on that responsibility and put all those candidates actually under their payroll for the on-the-job training part of the project. So that was a hardship. And they actually had a lot of oversight for the project. Jesse was very hands-on. And unfortunately, we had a transition of the workforce development office for Norwalk ACTS, but fortunately went to Norwalk Hospital, who became like really instrumental in kind of connecting students to their employment opportunities. So Rhea was really very helpful there. Next slide. To improve things. So obviously that's kind of what this pilot was all about. I think we would make sure that there's extended planning, that we're really clear on what the HR processes are before we launch the project. I don't think we realized how much time was required, even because the hospital actually wanted to do their own healthcare screening and background checks that process. And then, that whole nuance behind the patient access liaison, kind of having that determined beforehand would have changed the timeline where we could have probably eliminated some gaps. And one of the things that I've been learning about is really using a temporary staffing model, and learned about this later that actually CRI has been using that type of model for the reentry population to kind of give employers a chance to just provide, on the job training opportunities and then consider folks for employment afterwards. They also do all of the background checks and, healthcare and all of that, and they assume responsibility for the person until they're employed, or if they're employed by the employer. So it's a model that we're exploring for future work, because it actually takes the burden off the employer and has it on the agency who assumes that responsibility. And obviously, communication is critical in these types of partnerships, and just making sure that we have real-time tracking processes in place. And try to get as many, like, it's very hard for employers to commit, especially in healthcare. So many nuances that we came into, like, actually, at the time, when the job is posted, internal candidates, other candidates that might have better experience, are they meeting their metrics to be able to bring on somebody? There's a lot of things that kind of go in to being able to offer specific openings. And that's why I think that temporary could be a possible solution going forward. Next slide, please. We talked about the standardized documentation. Obviously, the partnerships, this is really something for employers to do with probably someone like Metro North, or even, with the buses, is to make sure that they run and get people to their facilities, when the shifts and times start. I don't know what time. It might have been a 7 o'clock start time or 8 o'clock start time that the train wasn't getting in at that point for somebody to get to work. I think is something that all employers on that extension, all the way from Norwalk to Danbury, could benefit from, is just making sure that we can get folks to work on time. So that would be something that I think employers should get behind with Metro North. And for Norwalk ACTS to continue this, they will need additional staff and resources to continue to do that. And it's something that we're talking as social impact partners in Norwalk ACTS to figure out how we could continue to support this work in Norwalk. And obviously, minimizing gaps is critical. You need to actually make sure this is very streamlined and efficient going forward. Next slide. But I would say the best part is that this is being sustained, that Norwalk Hospital, learned a lot from this experience. They're going to internalize a lot of these processes, and they're going to be doing this with their career readiness program. We are exploring Norwalk is social impact partners, where we're looking at a lot of healthcare partners and a lot of careers that are amenable to these on-the-job training opportunities, and really working to see if we can develop more of those models. I think we identified some really key components that make this a scalable model and could be successful for any employer. And really, it's the employer commitment. And this is where I really have to say Norwalk Hospital was a really great partner here. They worked very hard with us. They were very committed to the cohort, and they were really flexible and working with us. And I was very grateful to Marcus and Rhea. The comprehensive supportive services, having partners like Financial Opportunity, I'm sorry, Open Doors Economic Hub, I keep calling them the FOC, having that partnership to be able to provide supports was really, really important. And then paid, we wouldn't have been able to do this without the grant from M&T. And then the achievement coach. I mean, honestly, that was a very trusted person for the cohort that really worked with them from the entire process. And that cohort approach is actually a really effective approach. It builds a lot of community, and kind of it does a lot to keep people engaged, especially at the opportunity youth age group. And this can be adaptable, obviously, to other hospitals, other health systems, other roles, but it also goes way beyond and can go to other sectors. And successfully, I mean, Norwalk Hospital has been successful in engaging philanthropic support to diversify funding here. So that's also another success. And I think this is my last slide. Yeah, so I get to stop talking, and I get to bring on other partners in this work, which is Marcus Paca from Norwalk Hospital. You met Jesse, and we also have Sandra from CRI. So I think they're going to come on screen with me this stage.
Bernie, am I kicking this off, this part?
Yeah, I'm going to have you kick off, Jesse, and maybe just like once we're all four on the screen. I think they're trying to get us all. Are we all on screen or the speakers?
Well, I'll start as we get things going. So,
Great.
first off, I just really appreciate everything Bernie went through. One of the pieces of the partnership between us and social impact partners was really to help codify the learnings and to put this in the report. The purpose of this presentation today is not to say how incredible, the model is or look at the impact, but beyond that, it's really just about sharing best practices and lessons learned. This is the first time something like this has been done in Norwalk in this particular way at this scale, and we learned a lot. We faced a lot of challenges, but what we really want to know is what would it take to scale this in Norwalk to more young people and to other sectors to improve kind of the training opportunities that exist and getting young people on a pathway to livable wage employment. The three kind of insights I just want to focus in on from where I sat and my perspective was the importance of relationships. And that's really the nature of collective impact work. Progress moves at the speed of trust. And we are a trusted entity here in Norwalk, as well as with the organizations that operate here in Norwalk. We took a very much grassroots recruitment approach to finding the young people at Norwalk Housing Authority. And we do have a data sharing agreement with Norwalk Public Schools, as well as a working relationship with Norwalk Housing Authority that spans several years. So we were able to really pinpoint which of the young people have not enrolled in college or have dropped out from college from Norwalk Housing Authority that are still here in Norwalk and really working with those partners. The second thing I want to highlight is just the importance of this achievement coach role. Having a dedicated person who's a trusted liaison and an advocate for the young people from the start of recruitment all the way to employment is really critical. This achievement coach that we had, although we did have a disruption of who it was, the theory behind it was that this person was with the cohort from orientations to recruitment to interviews to with the young people every day at the 2-week Strive course, and then visiting them at the hospital for check-ins. This was the person meeting with all the hiring managers and the instructors, and really just a key liaison and a key person for both the young people, but also all the organizations interacting with the young people. And the last thing, and Bernie's hit on it a bunch, but I'm going to continue to hit on it, is having a committed employer at the table is so essential. The workforce development work doesn't work without a committed employer, and Nuvance Health has been a true champion in just rolling their sleeves up and really working with us. It was a two-way conversation the whole time during this project. The whole cohort of young people had met with Marcus at the beginning of the program, knew who he was, and trust was being built then. The hiring managers from Nuvance joined our orientations and supported mock interviews. And then Nuvance has a career navigator, a position that was really a key liaison in supporting all the interactions between the young people and the hiring managers and us. And they were open to feedback. So with that being said, I'm going to turn it over to Marcus to share his insights, but really appreciate everything once again from Social Impact Partners and the rest of the partners.
Absolutely. Thank you, Jesse, and thank you, Bernie. I'm Marcus Paca. I'm the Director of Workforce and Career Development at Nuvance Health. And I just wanted to first highlight the partnership with SIP, Carolyn, Wendy, Camille, Mark, and of course, our good friend Bernie. This has been a fantastic opportunity for us to highlight the workforce development work that we have been doing for the past 3 years. It's a part of our overall workforce model of allowing our hospitals and medical practices from an employee perspective mirror the communities that they serve. There's a strong business case that shows that when we hire people from the regional communities, local and regional communities that we serve, patient satisfaction numbers are higher, folks get a better experience at our facilities, and it helps with retention. So this is something that we've been doing and have been looking for a partnership with local and regional community-based organizations, academic organizations, as well as in the government and philanthropic world, so that we can sit as an employer at the intersection of innovative workforce development initiatives. So when Bernie and Jesse came to me with this opportunity, I pounced, right? Because I saw this as exactly what we were trying to do, and it's definitely in line with the governor's workforce initiatives, and we are a part of the regional RSPs. So transitioning into some major takeaways, I think one of the things that we would love to do better the next time is set and achieve expectation setting early and often, right? We want everyone to understand what they're getting themselves into. That's why we host information sessions. We try to be as upfront as possible about the process. Healthcare, as you all know, is a highly regulated industry. So there's no real clear path or no expectation around being able to guarantee employment. And what this opportunity did, I think, was put folks in the best possible position to be trained, to be prepared for a potential career in healthcare. And with the relationship building and the trust building, to Jesse's point, during the process with our internal hiring managers, who we bring in very early on in the process to get their stakeholdership and buy-in, these folks had the best possible opportunity to receive employment at New Vance Health. So I think that from that perspective, we want to make sure from a timing, programmatic, and outcome standpoint, we are consistently communicating what folks can expect through our workforce collaborations. Two, I don't want to make any assumptions, right? I don't want to make assumptions about what people know, what they don't know, where they're coming from, or where they are in their careers, or what services they may need. It's a process. That's why I strongly believe in the achievement coach model, having someone there to help guide folks through a process, help build up that trust, and helps us to prepare and be able to pivot on a dime when things and barriers come up with our programming and or our participants. I think we did a very good job at that. We did have a couple of mishaps, but I think generally and overall, our thought process was in the right place, and a lot of folks are better off because of their participation in this collaboration. And three, I cannot underestimate the value of the STRIVE program and the focus on professional development skills before they enter into a hospital setting. This is the type of training that is transferable, that can help folks within healthcare or other industries. And it builds upon a foundation that I think is needed for any person to be successful. So it has to be comprehensive, it has to be reiterated, but the work that Alicia and Sandra did at the STRIVE program, I think really encompasses what we now do on a much broader scale with the Career Readiness Academy, to Bernie's earlier point. And really, this process helped us to solidify that that training needs to be expanded, extended. It needs to be constantly driven home on a regular basis. And there needs to be follow-up and testing to ensure that folks are getting the basics down packed. So that was my third takeaway. And to Jesse and Bernie's earlier point, we are now expanding this pilot program into a Career Readiness Academy with a major funder. And we are looking to run several different cohorts that are basically going to take the takeaways and principles of this pilot project and expand it to a plethora of more folks within the greater Fairfield County region. So again, I would like to extend my warm felt thanks for this collaboration, for this partnership, for this opportunity to bring up the general efficacy of the future workforce of healthcare professionals in the region.
Thanks, Marcus. Thanks so much. And actually, I think we have Sandra Plessinger, who's going to be representing CRI, who is a really critical partner here because they provided our, screening, recruiting, job readiness, and the achievement coaching. So critical partners here. Sandra, you guys were involved in so many aspects of this project. I hope you have some insights that you can share with our group as well.
Thank you, Bernie. First of all, we want to thank SIP, New Vance and Norwalk ACTS for trusting CRI with the STRIVE training portion and also with the achievement coach, And as it's been said already, the Stripe Job Readiness Training was 2 weeks from 9 a.m. to 3 p.m. It was pretty intense to actually get the participants ready to do a whole shift of work, you know. We actually tailor our evidence-based curriculum, the Strive, into the PCT and PAL positions that Newlands was requiring. And they learned a lot of the soft skills. And as it has been said many times already, and it's always a big part of the Strive curriculum and what happens in our trainings is that a community is formed, you know? And so it was nice to see them all supporting each other, all talking and really helping each other into getting through the whole training. And I believe that also moved into the rest of the program and events, you know? So that was great. Also, we prepared during the Strive training the students for their job interview with the mock interviews. And we were very privileged to be able to do that with the staff of Newlands, you know, and the students then were able to get feedback. And then I think that actually helped them also with their interview later on, the official interview with Newlands. Another critical component that we always advocate in our Strive cohorts is to be able to provide snacks and lunch during the 2 weeks training. And I know, thank you to Norwalk ACTS to make that happen, you know, because it actually keeps the students engaged, you know, and also helps the mingling and the friendship that they create. I want to thank Ms. Alicia also for all her help. She co-facilitated, she did the first week and I did the second week. And I think it was very important that also Ms. Yvonne Matthews came and did the mock interview. So then she got to know the participants. And then when she took over the achievement coach position later on, you know, she already knew them and that relationship was formed. It wasn't not like somebody new. You know, I do believe that it's important the achievement coach should be the same all the time. And the importance of always participating from the beginning, you know, it's really important. We actually, in our other Strive cohorts, Ms. Yvonne always comes and meet our students during mock interview and sometimes over resume building as well, because that's an important component. What else? I want to thank Ms. Yvonne also for everything she did in that position, because I know there was a gap, as it was said already, of 2 weeks. So it wasn't easy just to take it over, you know. But I think she's great in connecting with the students. And as it has been said before, it's all about the people, you know, and she was able to help them finish and cross the line. And I do agree with Bernie that we do need to find a better system data entry, you know, to be able to enter all the interactions with the coach, you know, and also to be able at the end of the program, you know, to be able to assess and see what else we can improve and what it was done with each participant, you know. So thank you also personally, you know, it was a great experience for me. I don't usually train, you know, I train here and there when it needs to be. And I learned so much for the students. They were a great group of participants, full of energy, full of really wanting more, you know, they wanted to grow professionally. And one thing that they always mentioned, you know, it was the stipend, you know, they really needed to be paid during the whole training to be able to do it from beginning to end. You know, it's very hard for them not to do it if they're not being paid, you know, so that was a very important component. And they were very passionate, vocal, advocating for themselves, you know, which it's great to see in the youth, you know, and I wish we can extend this to do more of these programs. Thank you.
Thank you, Sandra. Thanks, everyone. I mean, this was such a great partnership. And as you can tell from everybody speaking, so committed. Like Marcus was so committed as an employer partner, and it really trickled down. Like when I say the on-the-job training folks were so committed to the success of this cohort, Sandra, Alicia, Yvonne, like everyone was really rooting for these kids and giving them every opportunity. So like even when there was like non-professional behavior, like tardiness or missed days. People were giving them extra chances. And it was like really hard not to finish, to be honest, because things were being extended, there was opportunities, and kids wound up getting other jobs, and CRI continues to support these folks. And I'm happy to say Yvonne's actually, I think, still working with Newvon's Health and really at their career academy level, right, to support those candidates going forward. So it's really great. I don't know if we can, Yvonne's on there, good. Yeah, Yvonne, if you want to just take a minute, because you've been such a great part of this process. Honestly, you were such a support to all of us and to the cohort.
I truly enjoyed the whole process. I did come in, as they say in our community, on the dime. You know, it was I had to jump in, and it was like jumping into 6 feet, a 6 foot pool of water. Yet, I know how to swim. So I was able to reconnect with the students that I met during the training, the 2-week training, and during the mock interview process. And as Sandra said, you know, that was the key, because if I didn't have that, it would have been different. Ray, I have to say, Ray and Jesse, I felt so supported. It was unreal. Every question I had, they had answers. They gave me direction. They showed me who and who not, and it was just really good. The students, even the ones that were not selected for employment, they were really amazing, and they were very interested in continuing their work search. And so some of them I'm still in contact with through text. Some of them are doing Ubering or other type of work, but they are working, which is crucial for them. Everybody has their own story, as we all know, but just connecting them to while they're living their life, building their own tapestry, we were able to connect them to their dream. And those who wanted to work at Norwalk Hospital, it actually happened for those 8 individuals. And you guys have no idea how wonderful that is. Michelle, also the trainer at Norwalk Hospital, she was awesome. She poured in a lot of what the persons who were working on the floor, what they were going to have to do, what they had to deal with. She gave a lot of hands-on experience. It was just an awesome, awesome experience. I said to Marcus at the graduation, you know, this whole program is a job developer's dream, because you already have your employers, you have the people, you just make gently and, you know, and precisely you make the connection. You just can't jam them together, but you just kind of connect them gently, and you can just watch them bloom. So thank you.
Thanks,
Thank you,
Yvonne.
Bernie. Thank you, Marcus. Thank you, Sandra and Wanda and Scott and Jesse and Ray. You guys are really, really, I appreciate your support and our working together. I hope to do it again sometime.
Hopefully soon. So
Yeah.
thank you so much. Thank you. So this is the part of this, you know, you've all been so patient listening to me and all of us. We'd like to open it up to some questions. And I do see some in the chat that I could get us kicked off with. And if you want to ask it, I could just give you the spotlight if you like. But obviously we have Karen from M&T just saying thank you. Thank you, Karen. I don't know if we can show you, but thank you so much for your support. Obviously, it was incredible to have you supporting this initiative. And as you can see, it's been really great work for all of us. Enrique Jocadella is actually also had something in the chat, and he's actually from the Workforce Solutions team, and he's been working with Marcus and Leah on actually the human-centered design. So Enrique, would you like to ask your question instead of me? You're on mute.
Thank you, Bernie. Yeah, just a quick reflection on this is a sort of a universal cognitive bias, which is the gap between what we think this project is going to require going in as to opposed to the after when the dust settles, you realize the enormity of all the coordination and multiple stakeholders. And I would like to get a bit of a feedback on your insights on this. And maybe the question is for you, Bernie, but also Jesse and the others. Thank you.
I can take first stab at it. Essentially, I thought this project could have been completed within a quarter. So we lost about 2 to 3 weeks between the job readiness and the on-the-job training there. And then there was a month where folks were going through the employment process. So that was the 2 months that I didn't I thought we could streamline a little bit better. As Marcus said, it's really hard for these employers to actually say, we can guarantee employment at the end of that, on the job training. So they do have to go through the employment process of the institution. And that's kind of where I see this temporary staffing kind of model was like, we could have done the background checks, the healthcare, screenings, and kind of had that person be responsible for them until the employer felt that they were a good candidate for the job, right? And then they could go through that employment where they would still be supported financially, I think is really what we're trying to do, right? Because as Sandra said, it's almost impossible for people, like these kids were doing Uber jobs or doing other things that they actually had to stop to take advantage of this opportunity. And they do need money, like the stipends were critically important. And I did see a question in the chat, and I think that was from Garrett. Hi, Garrett. But essentially, these folks were paid $16 an hour, which is the going rate for the roles, entry-level positions, and they were paid for about 4 hours a day for 4 days a week. That was pretty much the stipend for the entire process. And the sign-on bonus was about I think we gave them 200 to 300, Jesse, for that 2 to 3 week break to keep the incentive bonus to keep them engaged between job readiness and on the job training. So those were kind of the financials that we had in place to kind of keep folks involved. The roles were structured where they were there 4 hours a day, 4 days a week was kind of their on the job training time, and it went over a 6 to 8 week period of time. So that was the factoring for how we provided stipends. They also, Norwalk Hospital was generous with they had access to the cafeteria. People who were offsite, we gave them money. Like Sandra said, we paid for food during their training, the 2 weeks at the Envision Center. All those things are extras that the kids just don't have money for, right? So anything that we could help with. And then obviously transportation, giving them money for accessing the transportation that they needed to get to their training. So I think at one point Newbon's actually even provided a bus for the 1 week of orientation that everybody had to go up to the Danbury campus. I think we had a cohort that spent their first week. So we had a shuttle service that was bringing them up and down to the Danbury facility. And I'm sorry, I think does that answer your question, Enrique? I was trying to answer two, I think.
Yeah. Thank you, Bernie. Yes.
Thank you.
Could I butt in for a second?
Sure, Garrett.
As Bernie, I think I've been involved with Europe for many years and worked there for 6 years actually as president. And we're in 20 cities, and we train about 4,000 young people, Opportunity Youth a year. And this is incredibly thoughtful and sophisticated, and the learnings are totally on target. And what you guys have done is really extraordinary.
Thank you, Garrett. Coming from you, I'll take that as a real.
It's very exciting. And it's as everyone learns in this process, it's all about one-on-one relationship between supportive adults and building trust and doing a lot of things like but you've cracked the code as far as I'm concerned. All this stuff, the achievement coach and the cohort training and the stipends and the committed employer, and I made a list and it's extraordinary. So hats off to everybody.
Yeah. Critically important. I mean, it does start with the employer. I have to say that commitment to even just providing these on-the-job training opportunities, and that, that was hard. I mean, Marcus can tell you that patient access liaison role was a new role for them. Like, we didn't know there was going to be like labor negotiations and other things that he was going to have to tackle. And that's where that break came in. Like, that was not part of the plan. And it was just something he gracefully, I have to say, very gracefully navigated. Marcus, I have to say, you were a champion. You stayed consistent and unwavering and very committed to the kids. I mean, I think that's something like all of the hospitals are starting to see, that workforce development is a health equity intervention, right? Like employing people from the local community and economic advancement is a health equity intervention. And his role, at the hospital, not everybody has that, so his position is unique. And even having someone like Rhea, who was internal, like having those folks kind of really advocating for the cohort was very, very critical to this work, in addition to the team that we had. So having Yvonne being there, being the connector with the on-the-job training, and then Rhea kind of saying, these are all the jobs, this is the process, this is how you go through it, helping the kids navigate that. These are hard processes. Like, the reason we're having the issues is that these HR processes for especially opportunity youth are very difficult to be navigated, and they cannot do it their own. So saying to somebody, here's the opening, apply for it, is really not helping them all that much. They do need a lot of assistance. Now I see a hand up. I see Ben, my dear friend Ben. So I'm going to stop and let him talk, and then I'll keep going through my list.
And I'll go quick because I know we're over time. I think this is an awesome program. I think it's direct. It reaches people on the ground. That's really important. Zooming out to the macro, my latest obsession is the concept of abundance. And I'm with like-minded friends here, so I think a lot of people are probably aware of it. It's a book by Ezra Klein and Derek Thompson. It's basically saying that as a society, we need to produce more of the things that we need. I think everyone agrees that we need a lot more healthcare workers. And one of the things that the book really hits on is a lot of policies that are well-intentioned have actually led to scarcities of things. And I think during this presentation, like some of the key learnings you brought up, like maybe some of the HR practices and such in healthcare, and of course, regulations and all that, they sort of fit in that idea that some of these policies are difficult to overcome when you want to bring people towards healthcare careers. And I guess my question, this is partly from Marcus. It sounds like the Career Readiness Academy that you're launching at Nuvance is sort of going to be your incubator to make more programs like this one. In addition to all the awesome partnerships and support services and things you might be doing, are you also looking at what sort of policies are in place that are keeping people out of these careers?
Yeah, excuse me, Ben, that's a fantastic question. I often say internally that I'm in the business of changing minds. All right, like externally, it's great to partner with our academic folks, our nonprofits, our philanthropic and government partners. It's always great, but internally, it's a totally different challenge. Not everyone agrees with this work. Or thinks it brings value add. So being able to communicate to folks and show how solid workforce programming can help fill strategic sourcing gaps within our organization has been key to getting the buy-in of the people that I need in order to make our programs successful. We were able to implement just over a year ago a 16-year-old hiring policy, which helps us to pipeline folks directly from our technical colleges in the state into Nuvance Health and have them come on as per diem workers. That was a huge policy win, right? Something that not only raised the level of engagement with our younger healthcare professionals and future healthcare professionals, but also gave us a certain level of efficacy from a policy perspective internally, and let folks know that this was something that's being prioritized. So, from my boss in talent strategy to the CHRO to Dr. John Murphy, our president and CEO, they all believe in this work. So I get a lot of the support. And now that we are building out the Career Readiness Academy because of the success partially of this program, this pilot program with Norwalk ACTS and SIP and our other collaborators, we are looking at other ways to provide that wraparound blanket that gives folks a better opportunity at getting a job a little bit more easier than having them go through the entire application process that is currently required. So I'm constantly advocating, constantly putting together ideas and working it through finance and legal and the unions to see how we can codify this workforce development work. And now that we are launching the Career Readiness Academy, I think that's going to be the pathway for us to create those types of internal processes and policies that help drive this work going forward.
Thank you. It's great work.
Thanks, Marcus. Obviously, he has been a champion, and like it was no small feat. I mean, it's for the students, like 2 to 3 weeks for him to accomplish all the people he had to go through. He just listed business, labor, internal, even working with his internal managers. I mean, there was so much there was just a lot of learnings, like biases and things like, with the population, what was deemed professional behavior, non-professional behavior. Like there was lots of learnings from this pilot that I thought were really important, and advocating for the kids really was really great. I hope I got everybody's question. Did I miss anyone, Alex? I don't know if we
just
answered
have one more question from Chris Kuhnhart.
Chris. Okay, sorry. I had Alex. I don't know, sorry.
Yeah, that was just me asking about whether there are any learnings from the recruiting and screening process. I think you said you started with 75 or more expressions of interest to end up with 15 prospective trainees. Would you go about that process the same way or do something different next time around?
I can hop in. It's a really great question, and we thought about what we could do with the moment, with the amount of time we could. So at the orientations, which we had 3 of them, one at each Norwalk Housing Authority village, so Rudner Court, Colonial Village, and then at the Envision Center downtown. And so at each of the orientations, we had all our partners share out the available resources. So for instance, Open Doors presented what their Economic Opportunity Hub offers. And even though we weren't able to get everyone connected to our program as a candidate, our hope was that by just the resources being shared out at like the orientation from a partner like Open Doors would at least lead to, if support is needed, then you can go there. There were a lot of individual pieces. I didn't really codify them in the report, but there were a lot of individual conversations. I'm looking for this. You could go to that. And the last piece, which was it remains a barrier for us, Norwalk, and really our country, is around translation services and offering. A lot of folks came with English as a second language, and we just couldn't offer the trainings and supports in this pilot model in a different language. But that was a huge barrier in getting some of that 75 further along in the process.
Yeah.
So if I were to do it again, I would have more partners and more of like a resource fair hub surrounding these orientations. So we could, if it doesn't fit for us, we can get them connected to other things.
Yeah. And in addition to that, Chris, I would definitely, like I said, expand like a STRIVE program, so career, workforce, and soft skills training module, so that those learnings can be really prioritized in the minds of the participants. What we want is a well-rounded healthcare professional, but those soft and transferable skill sets can be taken anywhere. So, like, I am totally open to folks coming through my program and then going to get a job at Yale or Harvard, because the model works, right? And a rising tide lifts all boats. So I think that I would probably focus on that. But from a recruiting perspective, I thought we did pretty well. I mean, it's a pipeline, right? You start off with more people than actually get into the program. It helps to weed out folks that aren't serious. And it also gives folks some skin in the game, because we're investing a lot of time and a lot of effort and a lot of money, finances into them. So we want to see a positive return on investment. We definitely saw that with this program. So that's the only thing I would add.
And Chris, it was highly targeted. Like we specifically, in any work, we went specifically for opportunity youth. They had to be from the Norwalk Housing Authority catchment, right? So it was a very limit. That was also a lot, like we were getting some folks that were 27, 31, like we couldn't accept them. They weren't from the housing. So there was like some issues, like, kind of silly things, like people who would have loved to have been part of the pilot, but couldn't because they weren't in the catchment. Enrique, I see your hand.
Thank you. Yeah, just a quick comment on Chris's question, which is that in our universe, people often underestimate the notion of the funnel process, which is that like 2 years ago, we placed 28 quality and inspection technicians at Pratt & Whitney. And we handle a pipeline of 400 applicants. So our funders end up asking, well, we give you all this money and all you get is 28 people into jobs. That doesn't sound very high, right? But the work is with 400 candidates. And so that's something that I find that is a sobering reality in the work we do.
Yeah, and we really didn't capture that work. Like the report really focused on who we were able to serve with the grant, but Norwalk ACTS and Open Doors, like this is where Open Doors Connecticut really was a vital partner because, and Career Resources actually, like, because we were able to connect folks to their services, like the American Jobs, other things that are available to the population that maybe this was not the right fit for. So we didn't capture that work, which shame on us because that is real work that was done. So to your point, that's what I'm saying, like workforce development, we're accountable for how many people we train and how many people we employ, which is, yes, that's the success, like changed 8 individuals' career trajectories, I think is really, really cool. But the work that really happened here was like bringing the partners together, the lessons that we learned, that this can be replicable, that this can be done, more efficiently. I think those are really kind of the fun things that we learned. And you can see like everybody on this call really had a great time doing what we did. So it was a really rewarding project. And I think hopefully, we'll get more support from employer partners to do the kind of work that Marcus has committed to do. And that's really where we are in healthcare. I mean, like looking at these jobs and looking at on the job training opportunities and how can we get people into these jobs and kind of save dollars, like, right, training dollars for like certified roles once we know that people are actually, the right fit for the right jobs. So it's fun work, but the connective tissue, working with the partners in the community, trusted messengers, trust, like everything that Jesse's kind of taught, none of this could have happened without all the work that's been kind of going on before this time. So we were kind of set up for success in a lot of ways. Marcus has been working on this. His organization has been, like none of us came into this work just doing this for the first time. We had tried it in various different ways in different areas. CRI has the Strive model, but they had tailored, they had already developed a healthcare model for Waveney through the Career Connect grant. And then we tailored it specifically for opportunity youth, right? Like what would they specifically need for their needs are different. And highly specialized, right? They're young kids, don't have work experience, sometimes don't have resources, they don't have a clear plan. And, they needed a little more TLC to kind of get them to the finish line. And that's what the grant funded. I mean, it was really funding for our achievement coach, like that person and that amount of time that it required, it was real labor, right? So when you think about stipends and things like that, it was also funding for that supportive role. I don't know. Are we way over? I thought we had until 1:30, so that's why we're at 1:14. But do we go way over on this?
Yes.
Oh, good. Oh, sorry.
Bernie, I just wanted to, it's Mark. I just wanted to kind of make a quick comment. First of all, congratulations to this team. Thank you so much for your leadership and commitment to this project. Just really appreciate all of you. Marcus, the partnership with Nuvance, fabulous. Jesse, thank you for your leadership in kind of conceiving of this whole thing, and Bernie, your great work, as well as all the partners on the call. It does show you that if we're really going to address economic mobility, it really does take a community-wide collective impact approach. As Bernie said, we're very excited about the opportunity in healthcare. We know there are across the state thousands of openings in healthcare. And as I think Marcus said, hospital systems are really committed to hiring people from local communities, and especially expanding opportunities for people who might not apply on their own. And so I think this is a really big opportunity for us throughout Connecticut. to build out this whole ecosystem of recruiting, training, preparation, and even support after employment, and then the career pathways for advancement. And we're very excited to work with Nuvance and our community partners like Norwalk ACTS and CRI and others on this call, and really look forward to growing and expanding this model.
Yeah. And let's not forget, Mark, thank you for saying that, first of all, but Nuvance is in the process of being going into an affiliation with Northwell Health out of New York State. It sounds like the deal was just approved, and there'll be an announcement coming up soon. So we are soon going to be going from a 16,000 employee system to a over 100,000 person employee system very, very shortly. So their work in workforce development is just as important to them as it is to us. I'm even a little bit more happy that they don't even delve as deep as we do, right? Like they support the work, and they have a high school with Bloomberg that's been very successful, like a healthcare high school and I'm partnering with this public school system in Danbury to kind of help mirror that model. With the support of an employer, but they don't delve into the community relationships. They don't delve into the recruitment, specific, targeted, strategic sourcing like we do. So there's going to be something to teach them on their level, and also financial resources, hopefully, that will come from them to help support broadening of our collaborations in Connecticut as well. So just keep that in mind.
Yeah, that's great news, Marcus. And I shout out also I saw Shannon Merriman is on this line, and she leads Ready CT, which is doing work in high schools right now, has healthcare career pathways. They have a program that they've rolled out in different parts of the state with Hartford Healthcare, for example, but I know are open to working with other healthcare providers, Marcus. So
yeah, absolutely.
Just
Shannon and
advertisement for Ready CT.
Yeah, we're close. We're close, and we're already in conversations for her and her organization to help us in the next iteration of this particular pilot. So, absolutely, absolutely.
Well, thanks. As you can see, this is a love fest that could probably go on for another hour if you but sorry, I honestly thought we had until 1:30. I don't know where I came up with that number in my head, and that we were opening discussion at a time to give everybody time to ask questions. I don't really see many anymore. I hope we answered everybody. But thank you. I'm just honored that anybody wanted to listen to this with us today, because we're obviously excited. We did we were very happy with the work and the pilot, and learned so much, and so grateful to share it with all of you, and hope to get to do more of it. So thanks, everybody. Thanks so much.